Good morning, students. Today we will see the different approaches of community health nursing. As a community health nurse, for example, many diseases are coming, sudden pandemic is coming, or any flood is coming, or some disaster. So every time we cannot use only the primary health care approach or the health education approach or health awareness cannot be. Sometimes in a different situation we have to see the use the differential approaches. Okay, let us see which approach can be implemented in which time of period we can remember. First one is approach is a epidemiological approach. You know what is epidemiology? Okay, a study of distribution and determinants of the health related events in a particular population and apply this study to control the disease in the country or the community. This one, any endemic outbreak, or even you can use it as a pandemic outbreak. Many of things you can use by the research methods also, like descriptive data analytical study, experimental study, you can do it. So during pandemic also they have done many researchers, even they found out the vaccines and everything. Next one is a evidence based approach. In this evidence based approach they are doing a mainly drug trials and clinical trials they are doing, and making the drug efficacy they are checking before supplementing to the large amount of the population. Okay, then what is called the primary healthcare approach? Primary healthcare is a approach is a, what is primary healthcare? Primary healthcare is a universal healthcare, universally accessible, acceptable by the people, with the country also can afford it with the cost it can bear for this. Understand? So primary healthcare approach will be differ from each country to country. For example, if you take New Zealand, for them after 40 years they will call primary healthcare center will be call them for some mammogram checkup they will call. But how are we? It's a populous country. So according to us, we are applying. How they are applying? All the programs, nationalized TB control program, cardiovascular disease control program, DOTS program to control the communicable and non-communicable diseases. All are the channel through the primary healthcare approach. Next is a service approach. Service approach is a door-to-door service. Even a pandemic, sometimes they went to door-to-door. They supply medicines and something they have done it. But one time it was a failure approach. Rockefeller Foundation, what they have done, they were doing a 1960, I think. They were finding out that a lot of people are dying with anemia. Root cause of anemia is the hookworm infestation. Barefoot people are going open field defecation. So what they have done, they constructed the toilet at free of cost. After some time they go and see people never use the toilet. Again they were going to the field for the defecation. The main failure of this approach was the felt need was not there. Okay, so that was a failure approach, and it can be implemented for the another circumstances. In a corona it was a successful approach. And well, the health education approach, like prevention is better than cure. So this one, nutritional education, accident prevention, personal hygiene, dental hygiene in the school, colleges, in the industries, we can anything you can give this approach, it will be very good. And this also health education bureau is there present, that they supply all the health education material to all the primary healthcare centers, and through the posters, mass media also they make small short videos, also they implement the program. Then will be regulatory approach. This approach also mostly will be useful. People is always will be afraid for the laws, rules and regulation, or the punishments. It is called the law and the legislative approach. For example, people are not following a traffic rules, and the Chennai is maybe standing a third city for the accidents or something. So wear the helmet we are telling, but they may not wear the helmet. So if you do the punishments, if you seize the passport or something, it will be work out. So that's called the regulatory approach. Next is the approach is a family approach. Family approach is the one person is affected by the communicable disease, the whole family as the unit of service. So we will be taking that one, any communicable disease or sexually transmitted disease, we are carrying the whole family so that it will not spread again, maybe either the HIV or any other sexual diseases. Group approach will be always implemented to the environmental sanitation, and the prevention of communicable diseases. And individual approach, this mainly by the one-to-one counseling. For example, sometimes some of the children have the suicidal thought will be there, and sometimes domestic violence will be there. The cause will be unique, will be it will be differ from one person to the another person. So to come out those problem, you have to approach in the individually when you are going for the home visit. Empowering approach. What is called empower? What is called self empowerment? It helps one who can identify what is their own need and what is their own problem, and they find their own solution, and they try to help themselves to come out their own problem. That's called the women empowerment. Tamil Nadu has done a beautiful this one. It's called, they developed the self-help group, women self-help group. So with that, the small financial thing they are sharing, and they improve their financial status. Women empowerment is a very good approach. This one also we can use for the educational and other side. We can not only in finance, women can be empowered by the education and other services. So many non-governmental organization voluntarily helping for those poor people for empowering themselves. Next is problem solving approach. So in community, particularly many problem will be there. How this problem will be solved by either the political or the non-political leaders. They are available, and they are with their resources. What is the available resources are there? How they can conduct the meeting with the leaders, and they identify their own problem and they can solve the problem. So if any questions coming for different approaches of community health nursing, you can write. There are 11 approaches you can write. Understand? Family approach, group approach, individual approach, empowering approach, problem solving approach, as well as epidemiological, evidence based service, health education, and the regulatory approach. Thank you.